Holistic Edu-Consult. My name is Adeyemi-Levites. As you know, Holistic Edu-Consult is all about holistic education, a place where we do not just focus on the cognitive aspect of education alone. We focus on both the cognitive, the psychomotor, and the affective aspects of education. Today, we are talking about school health services, one of the components of school health program. Now, we have 4 components of school health program. School health program. School health program. We have 4 components. One of them is healthful school environment. Healthful school environment. The second is school health services. The third is school health education. And the fourth is school community relationship. But today we want to focus on school health services. That is what we have in our studio today. A doctor, an accountant, and a health specialist. I won't be able to read out his profile because it is so long. That means we have to spend so much time talking about who the guest is today. So I'm just going to briefly tell you that he's a health professional, a health care finance professional. He's been in the business for over 10 years. He's an accountant, he's a medical doctor, and he is one person who is goal-driven to make sure that health care financing in Nigeria becomes a thing of envy for almost every other sector. Yes, that is what he says. So today, our guest is in the house. His name is Dr. Adeyemi-Levites. Before I bring him in, let's go on the 30 seconds break. Welcome back to Holistic Edu-Consult. Remember, my name is Mercy Odiaka. Like I said earlier before we went on that short break, I said we're talking about school health services today. One of the components of school health program. I explained to you what school health program is, and I told you the 4 components of school health program. But today, because we have a healthcare expert in the house, we are going to focus on just the health services, school health services. So, Dr. Adeyemi-Levites, you're welcome.
Thank you very much. Thank you for having me on this program.
Thank you for joining us. Thank you for agreeing to be with us, even with your tight schedule, because I know we have just about 10-15 minutes with you.
We'll maximize it.
All right. Thank you so much. Okay. School health services.
Yeah.
I've seen a situation where we have schools not having a nurse. Let's say a nurse. I'm not talking about a doctor now or a school registered under a hospital. I'm talking about a nurse. No school nurse, no first aid box, no healthcare facility. Let's say a child has a slight injury, a minor injury. There is nothing to actually give that child first aid before the child is taken to the hospital.
Yeah.
So, what do you think about this? Do we need a nurse in the school? Because I have spoken with several proprietors and I hear there is no need for that. Once I have first aid box, once I can actually apply methylated spirit, once I can apply iodine, then every other thing is settled. So what do you think, sir? Do you think we need a school nurse?
Okay, all right. School health should actually be looked at from 3 different perspectives. I know, first of all, there must be preventive school health programs.
Okay.
There must be curative school health programs, and there can be rehabilitative school health programs.
I think you need to take that again.
I'm going to take it again. Preventive school health programs, curative school health programs, and rehabilitative school health programs.
Preventive,
yeah, let me
curative, and rehabilitative.
Yeah. So the preventive part is the first aid box that they mentioned. Okay, you have first aid box in school. That's just preventive. Like, okay, you don't want any child who just had a wound right now to bleed excessively. So you have first aid kits in the school to make sure that when any child gets injured, you take care of that child. But that's still preventing at a secondary level. Alright? So that's a preventive measure at the secondary level. Like, okay, you're expecting that the child will even get injured in the first place. But the first preventive level you should take when it comes to putting children in a place called school is to, first of all, child-proof that environment. Child-proofing an environment can mean making sure there are no sharp edges around, there's no slippery floor, there is no such thing hanging in the room, each of the classrooms, that can actually predispose the children to danger. Maybe something they can go and draw and then it just falls on their head, like a cup or a wardrobe that is movable and they can actually just draw it and it falls down. Or maybe liquids that are actually poisonous, maybe like hand wash, for instance, as simple as hand washes in all the schools now because there's corona. Hand washes can be actually can be something that can be dangerous to children because children don't know what's right or wrong. They can put it in their mouth anyhow. Where is the hand wash being placed, for instance? The water that you're using to wash your hand, can children have access to it? You know, when you get to some schools now, as they're entering the gates, there's hand wash. Yes. Who is there to prevent children from putting their hand into that hand wash, for instance? So preventive measures, as simple as that, to as complex as child-proofing the environment, making sure there are no sharp edges around, making sure that there are no slippery floors around, making sure that the seats are they are built for the children's safety. Let me use that word. Things as even as serious as making sure that children are not having access to any sharp objects around, or things that can actually cut their hand, or something as simple as that, as preventive as that. That's what schools actually need to think about. So preventive is to prevent anything bad from happening. It's to prevent, or now corona is here, another level of preventive care would be, oh, the children having their shields on. Face masks might not be ideal for children because their lungs are not that large enough to taking enough air per time, so they need to actually have shields instead of what they call the face mask and all that. Even there are face masks that are built for children too that are actually children friendly, but those ones are not supposed to be so tight so that they can still breathe easily, and then a face shield will just make it very perfect. And then it should actually be fewer in a class, because the more they are in each class, the higher the chances of them spreading infections. It's not even about COVID alone, even every other kind of infection. Ideally, you shouldn't have more than 10 pupils in a class on a normal setting for each room. 10 is even a lot. In fact, my own son's school, the max you have in a class is 6.
Wow. All right? So one teacher?
Yeah, one teacher to 6 pupils. Once it gets to 10, then it's like high normal. They have to actually break that class. So that reduces the chances of them catching infections unnecessarily. There's spacing now. Corona is even here. They have to adhere strictly to that measure. All right, very, very important. So things like that have to be in school for preventive school health programs. Then I can't exhaust that, but there are obviously lists you can actually do. I can recommend maybe 1 or 2 sites you can actually check out. I'll probably look at that and send to you later on.
So that's some preventive
measures. Then on curative measures, where you don't need all those nurses around. A child just had an injury. To cure that injury faster, to make the injury actually get healed faster, you need nurses that have actually administered maybe iodine, like you said, or spirit, or cotton wool on the wound. Excuse me, to that any excessive bleeding that is going on right now. If it's not an injury, if it's that the child is sick, the child is vomiting, the child is stooling, there are certain things that nurses can actually administer initially as the first line of curative measures to take care of that child. But the second line of the curative measure would be to make sure that there is a sick bay proper. You can admit that child maybe on a 24-hour basis, or let's say 12-hour basis, before the parents come to pick the child. If the child is stooling and vomiting at the same time, you need to actually hydrate that child. It means that you have to set up intravenous infusions for that child in a sick bay that should actually be available. Things as basic as taking care of the child within 12-hour framework. Prior to the time the parents take the child to the hospital properly. Part of curative also is buying health insurance. Health insurance can both be preventive and curative as well. Alright. So preventive is you're preventing any mishap from going haywire. If a child falls sick all of a sudden or has an accident in school, if the child is under any health insurance plan, there's no point keeping that child in school, for instance, because there's a health insurance plan. You can stabilize the child in school and then transfer the child to a hospital under the health insurance plan. I mean, that can cover that child's health insurance plan. So, for instance, health insurance companies have relationship with hospitals, and if you buy a health insurance plan for all your children in school, for instance, or your pupils in school, for instance, you should be able to tell the health insurance company that I want a hospital close to my school, so that if anything happens to any of my pupil, I can actually just immediately send that child to your hospital, to the hospital within your network, without having to look for where to send the child to. So that is also both preventive, in the sense that you're preventing any bad thing happening after a child had an injury and it becomes a permanent disability or something. Fast action, making sure that the hospital is very close to the school works, that's preventive under health insurance. And curative also, if a child is having any infection or a child just falls ill in school all of a sudden, you can actually go to the hospital and get that child cured as well. So health insurance can be a curative measure, having a sick day in school can be a curative measure, and also you can also think about it this way. If you have a sick day in school, for minor illnesses, you might not need to actually go to the hospital. If a child is having malaria and is running temperature, initial administration of antipyretics, that's drugs that actually reduce temperature in children.
Well, how do you determine the child has malaria?
You definitely have maybe some kits in school. Some very sophisticated schools have that. You can have some tools that you can actually use as test kits for malaria, for instance. You can have test kits for malaria.
That means you have to have a professional on ground.
Yeah, sure. So that I'm coming there, because you cannot have tools for testing for malaria, for instance, and you don't have professionals who are maybe lab scientists who have actually been trained on how to use those kits. You can't give it to a teacher to be running that. It's not possible. So having a nurse, a lab scientist, some schools even go as far as having a doctor in place in case anything happens. Like some universities actually do that. They have school centers, school health centers, where a doctor proper is actually manned is actually manning that place to take care of children or students who might actually have one illness or the other. So that's the curative aspect. Then the rehabilitative aspect relates more to mental health for school.
Okay, doctor, before we go to that rehabilitative right now, you mentioned the preventive.
Yeah.
That means the school has to make sure that the classroom is not congested.
Yeah.
You don't have sharp objects around.
No slippery floor. No sharp edges.
No sharp edges.
Yeah.
Nothing. No
exposed electrical wires, for instance.
Okay.
Or against electrical shock or something of that nature.
Okay.
Yeah.
But if you look at most of our schools today, doctor, don't laugh yet. Don't laugh yet.
We're talking about the ideal here.
We're talking about the ideal, but we're trying to see how we can work it out. You know, we're told, we know, not we're told now, we know that change is always something people reject. Naturally,
people push back at
they don't really flow with change easily.
Yeah.
So if you're going to change anything, it has to be gradual.
Yeah.
So how do we now change it gradually? Because you mentioned 6 pupils in the class, and I've been to schools. I would like to even leave out. I would like to leave out the public schools.
Our so-called private itself.
Exactly. I would like to leave out the government schools.
Government schools, they don't even go there. You can have 100 pupils in the class.
I would like to leave that out.
Yeah.
But let's talk about the private schools that we think should have some of these things in place.
Yeah.
But they tend not to have them. Is it because they are following the footsteps of the public schools, or because in private schools the least you have in a class is 15, except that school does not have population yet.
Yeah.
Once they have population,
in fact, more than in some private schools.
Once they have enough population, they don't. The least you have in a class is 15.
Yeah.
And most times they don't even put. You know, when you're talking about school health program now, we're talking about the school environment as well.
Yeah, sure.
It has to be well ventilated.
Yeah, everything. Yeah, that's the preventive.
Well ventilated. There has to be proper drainage.
Yeah.
But all these things are not there. You will see a school in the midst of 2 buildings, residential buildings.
That's
where you have. So that's what I'm thinking. That okay, what do we do to effect this change? So, because when you say preventive now, these are some of the things that fall under the preventive measures you mentioned.
Yeah.
If you're trying to prevent some mishaps within the school, then some other things have to be put in place. The environment.
Yeah.
The environment.
Yeah.
You're talking about a school where a vehicle is passing by and
once you
honk on the car, you hear the noise.
Yeah, very true.
The child in the
passenger lane environment shouldn't be that noisy.
Okay, you said preventive now.
Yeah.
So what do we now do to make sure that these things you mentioned about the preventive now, let's do the curative. The curative is where you have the nurse on ground, where you have a lab scientist on ground, where you have some kids to check some of those things.
Yeah.
So what do we do to make sure those preventive measures stay? What can we do?
All right. Summarily, everything starts and ends with leadership. You cannot demand something at private level what the government is flouting at the public level. All right. If government schools are jam-packed, they are overcrowded, all these things you're talking about are not. The primary schools we went to enter school, you have to cross the main road. You have to cross as a child. You have to cross. I escaped being hit by a car when I was in primary 2 once. I mean, that's an example, but that's not how it's supposed to be. In fact, if anything like that is going to be close to, if any school is going to be close to a main road, there should be zebra crossing there or something like that. But in Nigeria, we respect zebra crossing in the real sense of it. That's an example.
We'll get
all right. So it starts with leadership. So if the government wants private schools to go all out and follow regulatory standards when it comes to how a school environment should be, then the public schools should actually start first. They should start first. Because the government is going to be saddled with the responsibility of making sure that the regulatory requirements in private schools are met. But if they are flouting the same regulatory requirements, they can't hold private schools responsible. And who is holding private schools responsible? Now, the regulatory aspect of it is now being maintained by private parents who will go to schools themselves and check, like, can my child school here? And if the answer is no, they look for a school that actually is as compliant as possible with all these things that we talked about in terms of preventive school health programs. And the truth is, if we don't hold government responsible and we leave it to private parents doing that, it's just about who has the biggest money on the long run. So it means that if you don't have that big money to send your child to big schools where all these things are actually done, there are schools in Nigeria that actually follow these regulatory standards, but they are very expensive. We are talking about school fees as much as 4 million naira, 5 million naira per annum. That's just school fees, not even including some other things that you have to pay. But how many people can afford that in the real sense of it? So the educational standards in the country is plummeting because people who are regulators, they themselves are flouting the rules. So the government itself is flouting the rules. So private parents are the ones that are now going all out to check schools for themselves and say which school is actually as compliant as possible. The truth is, very few schools. Sorry, I've been saying hospitals, patients, blah, blah. Sorry, I'm used to all that.
We understand.
Very few schools are actually compliant to this regulatory requirement. So the solution is, maybe there can be advocacy. Maybe parents can actually form forums where they actually really hold schools to the standard they are supposed to be upheld to. Like, you shouldn't actually flout this regulatory requirements if my son is going to continue attending your school, for instance. That's one level of advocacy. Another level of advocacy is after holding the schools responsible, parents can go as far as holding the government responsible as well. Like, regulate this thing. But the problem that comes with is, more often than not, if something has not gone wrong in Africa, we don't tend to have preventive mindset about things. Something has to go wrong first. Somebody has to die first. Something bad has to happen first before a government now says, okay, maybe we need to institute some policies around this. But preventive is, it has not happened. You want to prevent it from happening.
But that's not supposed to be the norm.
That's not the norm. I mean, we're talking about the ideally on this program. But the truth is, that's not what is happening out there. So the solution definitely is that advocacy at parental level and at government level, going to schools, pushing for schools to do the right thing from parents' perspective, Then apart from that, even parents advocating at government level, because that's the only way out. Most schools to institute all these things that we're talking about is not cheap. And if they ask you to pay the school fees, you run away from the schools. So I'm not trying to castigate even the schools themselves. The truth is, it's a very dear situation they find themselves. They have found themselves in a very dear situation, and they have to now balance, oh, should we spend so much money on preventive health care over curative health care, or should we just focus on, let's just let them come to school, learn what they need to learn, and get out, as long as pupils don't injure themselves on a regular basis. There should be school health register, for instance, so you can gather data as regards, how many pupils fell down today, why did they fall down? There should be incident reports as regards all that. But that's an ideal setting. There should be security cameras everywhere to even know what really happened, because that's how you can even get your incident reports right, all those kind of things. But if you ask every school to be putting on security cameras everywhere now, that's going to mean that school fees is going to go up. And once school fees get increased, people start leaving that school, they go to a school that is not demanding such. So in the long run, the economy is a factor, leadership in government, in terms of governance is a factor. The parents also have a major role to play.
Wow, 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 wow. Leadership, government, and parents have a role to play. Okay, I know we have this about 3 more minutes. Within the 3 minutes, Doctor, can you give us a little on the rehabilitative measures that you mentioned?
Okay.
You've spoken about preventive measures, curative measures, and the third one is
the rehabilitative aspect. Just give me 1 minute, please.
Okay, sir.
I need to enter this meeting and just mute my mic. Sorry, please forgive me so that I won't be fined. Alright. 1 minute, please.
We're so sorry for taking a few of your time today out of your schedule.
No worries.
Okay, so can we just roll, maybe just for the next 3 minutes? Let's hear the rehabilitative measure. I'm really curious to know about that.
All right, so the rehabilitative part is something that's gone wrong already. You're trying to restore that person back to normalcy. Usually more of mental health area, but maybe not just mental health alone. Rehabilitative care can be a child has had an accident. You're trying to make sure that child doesn't lose that being, or that child can actually get back to playing around and running around again. So you have to do some rehabilitative programs, maybe just have physiotherapy to come to check the child. Or in the case of maybe mental health, there are some children that are actually abused verbally, sometimes emotionally, sexually, at home, or sometimes even in school, depending on the kind of school setting. So rehabilitative care for school health program is more or less like something bad has happened already. You're now trying to, as much as possible, reinstate that child back to how it's supposed to be.
Okay.
So mental health majorly, actually, that's a major focus that rehabilitative care actually takes. Aside that, maybe physical body parts that probably have been injured. Post that injury, you have to do rehabilitative care for that child. Something like that.
Oh, so just one question on that rehabilitative part. Does that mean that in a school where a child is being abused verbally, probably by the teacher, do we say the teacher not abusing that child is a preventive measure?
Yeah, it can be a preventive measure.
The curative is the part where the teacher stops abusing that child.
Abusing and then the
rehabilitative is where the child is being
and all that, and then you rehabilitate. So that can be curative and rehabilitative as well.
Wow, wow. Thank you so much, Doctor. Thank you for joining us today. We are so elated to have you speak to us on school health services. I know you are an HMO.
I'm an HMO guy. Like I do healthcare financing.
Okay, healthcare financing.
Yeah. So if you want to get health insurance,
okay, can you just tell us in 1 minute?
All right. So I work with Reliance HMO at the moment. Reliance Health. You can just go to Google and check for Reliance HMO, www.reliancehmo.com. There are different products there, both for individuals, families. If you're a school, you can actually buy health insurance plans there, and then I think that's it.
So thank you so much, Doctor. Thank you for being here with us today. Thank you for taking out of your time to educate us on school health services.
Thank you very much.
Okay, in another 2 minutes or less than 2 minutes, we'll be back to review what the doctor told us about school health services. We'll be right back. Welcome back. That was Dr. Adeyemi-Levites. He spoke to us on school health services, one of the components of school health program. One of the things we need to put in place in our schools is our school health services. He mentioned the preventive measures. I'm sure you listened to that. You heard everything he listed. I think if you missed that, you need to rewind, go back, and listen to all the preventive measures he mentioned. He mentioned the curative measures. Go back, look out for the curative measures he mentioned, and make sure you implement them in your school. It is actually for your own good. It will actually portray your school better. It will make parents who are learned want to come to your school because they know that you have the facilities you are supposed to have. Then he mentioned the rehabilitating measure to put in place. Please, as a school, as a proprietor, as a school owner, put these things in place. Employ a nurse. Employ the services of a nurse in your school. Make sure there's a nurse in your school to attend to these children, to give first aid. Even if you cannot do the curative part, at least have the preventive part. Make sure you have the preventive part and you have a nurse in the school to help diagnose those things and know what to do next. Know the situation that can be handled in the school and the one that needs to be transferred to a proper hospital. It is the ideal, just like Doctor said. It isn't supposed to be the norm for us to have a school without all these basic facilities. So put them in place, and thank you for joining us today. I'm sure you got value. Though we didn't have much time today, but the little time we had, I'm sure you heard everything Dr. Adeyemi-Levites said. And he told us also that there's a plan for schools in their own HMO. So you can Google Reliance HMO. So check for the services that your school can benefit from. Till I see you another time, make sure you put to practice everything you hear here. Everything you learn here, put them to practice. Put them to practice. Remember, we say here, to learn is to grow, and growth is inevitable. Join us on this journey to the apex of education. This is Holistic Edu-Consult. Bye for now.